I'm Emily Baker. Here's the room where I'm going to be doing my assessment. I have a 10-foot Snellen chart. And here's my table with my tools. And here is my patient mark. And we will get started. Throughout the assessment, I'm going to be inspecting Mark's skin for color, temperature, moisture, texture, edema, turgor, lesions, nevi, scars, and bruises. I'll begin with Mark's head by assessing size, shape, symmetry, and that it's midline, noting his hair color and distribution and any infestations. I'm going to palpate his scalp for any masses, lesions, or depressions. Palpate occipital lymph nodes, post-auricular, pre-auricular, tonsillar, submandibular, submental, posterior cervical, anterior cervical, supraclavicular. Palpate Mark's temporal arteries, his maxillary and frontal sinuses. His TMJ, please open. No subluxation or crepitus. And assess cranial nerve 5 as I palpate his master muscle as he clenches his teeth. Excellent, thank you. Also assessing cranial nerve 5 will be performing light touch tests. Please tell me when and where you feel this. Close your eyes.
Forehead, left cheek, chin, nose, right cheek, left arm, right hand, right arm, left hand, left leg, left foot, right foot.
Excellent. Moving on to Mark's ears, I'm going to assess for shape, position, size, symmetry. I'm going to palpate the pinna and tragus for any nodules or tenderness. I'm going to use the otoscope to assess Mark's auditory canal and tympanic membrane. And we'll assess cranial nerve 8 with the whisper and the Weber and the Wren test. If you'll cover your right ear, please, and tell me what I say.
99,
And your left ear.
99,
So we'll also assess cranial nerve 7 by asking Mark to smile, frown, raise your eyebrows, puff out your cheeks, and pucker your lips. Excellent. Back to cranial nerve 8. Do you hear this louder in one ear or equal?
equal,
Okay, please tell me each time you stop hearing this.
okay, okay,
And on this side.
okay, okay,
Moving to Mark's eyes, I'm going to inspect his eyebrows, eyelashes, palpebral fissures for any exudate, swelling, redness. I'm going to inspect his sclera and conjunctiva for for any redness, lesions, or discharge. Assess cranial nerve 2 by asking Mark to stand behind the blue line, please. If you'll cover your right eye and read the bottom line.
SDKH ORCV.
Cover your left eye and do the same, please.
SDKH ORCV.
All right, you may sit down. We'll assess cranial nerve 3 by testing Mark's. We will continue to assess cranial nerve 2 by testing peripheral vision. You know, tell me when you can see my finger. Look forward.
Oh, I'm sorry.
Tell me when you can see my fingers.
Okay.
And again.
Okay.
Excellent. Assessing cranial nerve 3, we will assess Mark's direct and consensual pupillary response to light. If you will look up there, please. All right, accommodation, please look at the pen. And now look at my hand. All right, and convergence. I will use we'll assess cranial nerve 3, 4, and 6 by conjugate gaze with extraocular movements. Please follow my finger with only your eyes. Use the ophthalmoscope to assess for red reflex and internal structures and fundus. Excellent. Moving to Mark's nose, I'm going to assess for midline, straight. We'll assess patency. Please close your right nostril. Excellent. Your left nostril. Great. Moving to Mark's mouth. I'm going to inspect his lips. Ask him to open his mouth and bite his teeth down. Inspect his teeth and gums. Open, please. Inspect buccal mucosa, tongue, palate. Please raise your tongue, floor of the mouth, and stick your tongue out. Tonsils present +1, and cranial nerve 9 and 10 intact with equal symmetrical rise of uvula and palate with phonation. We're going to assess cranial nerve 12. Ask you to stick out your tongue to the right, to the left. Excellent. Moving to Mark's neck, I'm going to assess trachea for midline. Palpate his thyroid gland. Please turn towards me. Swallow. And turn towards me and swallow. Excellent. Palpate Mark's carotid arteries. I'm going to auscultate over the carotid arteries for bruits. Assess cranial nerve 11, asking you to shrug against my hands. Excellent. Range of motion of the neck. Please bend forward, back up, and back. Turn to the right, turn to the left, right ear to right shoulder, left ear to left shoulder. Excellent. Moving to Mark's back, I'm going to assess for any obvious deformities, any obvious signs of respiratory distress, and symmetrical chest expansion respiration. Please take a breath. Excellent. I'm going to percuss posterior lung fields. And please raise your arms. And auscultate posterior lung fields. Raise your arms. Test, you may lower your arms. Test for egophony. Please say E.
E,
E.
E,
Bronchophony. Say Mickey Mouse.
Mickey Mouse, Mickey Mouse.
And whisper pectoriloquy. Please whisper Mickey Mouse. Excellent. And testing tactile firmatives. Each time you feel my hand, please say 99.
99, 99, 99, 99, 99, 99.
Alright, you may turn to the front. And assess Mark's anterior chest for symmetrical chest expansion. I'm going to percuss the anterior lung fields. Each time you feel my hand, please say 99.
99, 99, 99, 99, 99, 99.
I'm going to auscultate the anterior lung fields. I'm going to auscultate the heart fields, the aortic valve, which is second intercostal space, right sternal border. Pulmonic, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid, fourth intercostal space, left sternal border. And the mitral or apical, which is also the point of maximal impulse, fifth intercostal space, mid-clavicular line. And I will auscultate for 1 minute. Mark has regular rhythm, S1, S2, no extra sounds with a rate of 72. Mark, if you will please lie down. I will first assess for any heaves or lifts, and I will assess for jugular venous distension. You'll please turn your head to the left and assessing jugular venous pressure. Just barely see a little bit here. Mark is very muscular. Place this at mid-axillary line level of the nipple. And that puts us right about 9 centimeters. We'll do the same on this side. Please look to the right. And again at 9 centimeters. I'm going to palpate over the heart fields for any thrills. And I will auscultate over the heart fields. I will auscultate over the aorta for bruits. Bilateral renal arteries, bilateral iliac arteries, bilateral femoral arteries. We'll auscultate 4 quadrants of the abdomen for vowel sounds. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. I'm assessing Mark's abdomen for contour and symmetry. I will percuss the quadrants. Apply light palpation, assessing for any masses or tenderness. And deep palpation, assessing for Mark's liver with my left hand between the 11th and 12th rib and palpating upward. And attempt to palpate the spleen with left hand in costovertebral angle, palpating upward. And do not feel a spleen. And Mark, you may come back to the chair. Alright. Moving on to Mark's hands. Each of the joints I'm going to be assessing will be for redness, swelling, deformities, tenderness, nodules, crepitus, and symmetry. I'm going to begin with his hands and his wrists. Check capillary refill in his fingers and feel his radial pulse. Same on this side. Capillary refill, radial pulse. Assess range of motion for his fingers. Please bend your fingers down and up. Spread them apart and back together. Make a fist. And please touch the end of your thumb to each fingertip and the base of your pinky. You will squeeze my fingers, testing strength. Assess range of motion for your wrists. Please point your hands down and up to the outside, to the inside. Excellent. We'll assess and palpate Mark's elbows. And check range of motion for his elbows. Please bend your arms up and back down. And if you will turn your palms up, palms down. If you'll place them on your thighs and continue to do that, increasing in speed. Excellent. If you hold your arms up, pull against my hands and push. Testing strength of the biceps and triceps. Moving to Mark's shoulders, I'm going to inspect and palpate. And assess range of motion. Please put your arms at your sides. Bring them in front of you all the way up over your head. And back down. And behind you. And out to the sides. And back together. And please put each hand in your lower back. Internal rotation. And each hand between your shoulder blades. External rotation. Excellent. We'll check reflexes. The brachioradialis, the biceps, triceps. Please just relax. Just relax. Excellent. If you'll put your arms at your sides and raise against my resistance and pull down against it. Excellent. All right, moving to Mark's feet. Again, I'm going to inspect and palpate his feet. And ankles. Assess capillary refill on his toes. Feel dorsalis pedis pulse. Posterior tibial pulse. Range of motion for toes, please curl your toes and bring them up. Spread them apart, bring them together. Range of motion for ankle, point your feet down, point them up, out to the sides. There you go, and inward towards each other. And if you'll bring the soles of your feet in to point each other and outward. Excellent. You'll push against my hands and pull against my hands. Excellent. Testing the strength. Going to inspect and palpate Mark's knees and form reflexes. Babinski reflex. The Achilles. Just relax. And the patella. Just relax. Alright. I'm going to assess vibratory sensation. Where do you feel this?
Right outside of my wrist.
And where do you feel this?
Left outside wrist.
Excellent. Where do you feel this?
Right inside ankle.
And this?
Left inside ankle.
Excellent. If you will hold out your hands and close your eyes, please. Testing stereognosis. What have I placed in your right hand?
Key.
What have I placed in your left hand?
Coin.
And you can tell me what I draw.
An 8. A.
Testing graphesthesia. All right, Mark, if you will stand up, please. Going to inspect and palpate Mark's hips. Test range of motion for his knees. Please bend your leg backward. Bend at the knee. Excellent. And bend the other one, please. All right. And if you will test range of motion for his hips, bring your right leg, knee straight in front of you, behind you, knee straight, all right, out to the side, in front of the other leg. Excellent. Now your left leg, straight out in front, behind, out to the side, and in front of the other leg. And if you will balance on me, we'll test external rotation and internal rotation, external rotation, internal rotation. Raise your leg out against me, no, out to the side, and pull in. Raise out to the side against me, and pull in. Excellent. If you will turn to the side, I'm going to inspect and palpate Mark's spine for alignment, any deformities, and expected curvatures. Range of motion, please bend forward. I'm going to assess for scoliosis as he's bent forward. Raise up, please. I'm going to turn back forward. If you will bend back at the waist without arching your back. If you'll bend to the right, to the left, and if you will twist. All right, please stand with your feet together, arms at sides, and close your eyes. Assessing Romberg sign. Excellent, you may open. If you will walk from here to there, assessing gait, and walk back heel to toe, please. All right, and if you will hop in place, hop on your right foot, and hop on your left foot. Excellent. Now, that concludes the assessment for Mark.